Silvadene cream is used with other treatments to help prevent and treat wound infections in patients with serious burns. It works by stopping the growth of bacteria that may infect an open wound, which helps to decrease the risk of the bacteria spreading to surrounding skin or causing a serious blood infection. It belongs to a class of drugs known as sulfa antibiotics. It's important to note that Silvadene cream must not be used on premature babies or newborns during the first 2 months of life due to the risk of serious side effects. Before you start using Silvadene cream, make sure to read the patient information leaflet from your pharmacist. This medication is for use on the skin only. Your doctor will clean and remove dead tissue from the wound to help with the healing process. You should apply this medication to the wound using sterile technique, as directed by your doctor, usually 1 to 2 times daily. The layer of medication should be about 1/16 of an inch thick or as directed. The wound should be covered with the cream at all times. Dressings may be applied over the cream, but only if needed. If some of the cream rubs off the wound, reapply it immediately. Treatment usually continues until the wound is completely healed or until the site is ready for skin grafting. Use this medication regularly at the same times each day to get the most benefit from it. If your condition lasts or gets worse, make sure to inform your doctor. You may experience pain, burning, or itching of the treated skin. Your skin and mucous membranes, such as your gums, may become blue/gray in color. If any of these effects persist or worsen, inform your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as signs of infection, like a persistent sore throat, fever, chills, easy bruising or bleeding, signs of anemia, like unusual tiredness, rapid breathing, fast heartbeat, signs of kidney problems, like changes in urine amount, pink/bloody urine, signs of liver problems, like persistent nausea, stomach/abdominal pain, vomiting, dark urine, yellowing of eyes/skin, or mental/mood changes. While a very serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects. You may also report side effects to Health Canada at 1-866-234-2345. Before using Silvadene cream, make sure to inform your doctor or pharmacist if you have any allergies, especially to sulfa antibiotics. Also, let them know about your medical history, including any enzyme deficiencies, kidney problems, or liver problems. If you are pregnant, only use this medication if absolutely necessary, and avoid using it near your expected delivery date. It is also unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding while using Silvadene cream. And before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using. When using Silvadene cream, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Silvadene cream include skin products containing sodium sulfacetamide, as well as enzyme products used to break down and remove dead skin/tissue from burns and wounds, such as collagenase, papain, and trypsin. Additionally, an inactive ingredient in some brands of this medication, propylene glycol, may be absorbed and could interfere with certain lab tests, possibly causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you use this drug. As always, consult with your doctor for the best time to apply this cream and the appropriate dosage for your specific condition. If Silvadene cream is accidentally swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or trouble breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. This includes contacting a local poison control center at 1-800-222-1222 for U.S. residents and a provincial poison control center for residents of Canada. It is important not to share Silvadene cream with others. Also, it's crucial to avoid smoking or being near open flames while using this medication, as it can increase the risk of severe burns. Fabric that has come into contact with the cream can also burn more easily, so it's important to wash clothing and bedding regularly to reduce the buildup of the product. Additionally, it's important to undergo lab and/or medical tests, such as white blood cell count, kidney function, and blood tests, while using this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to apply Silvadene cream, do so as soon as you remember. It is important to keep the cream on the wounds at all times as prescribed by your doctor. Remember to always follow your doctor's instructions for the best results. When using the US product, make sure to store it at room temperature. If you have the Canadian product, store it between 46 to 77 degrees Fahrenheit, 8 to 25 degrees Celsius. If you have the 250 or 500-gram jars from Canada, make sure to discard them 24 hours after opening to ensure that the medication is sterile. For the Canadian tubes, discard them 7 days after opening. Always keep medications away from children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you need help with disposal, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.